Welcome to Emend Healthcare. As a team, we share the responsibility of creating a safe, comfortable, and sanitary environment for every person who walks through our doors. Today, we are mastering the specific procedures that keep communicable diseases out of our facility. We will cover the mechanics of proper hand hygiene, how to handle medical sharps safely, and the exact steps to take when containing an outbreak. This diagram shows our first line of defense, standard precautions. This means treating all blood and body fluids as highly infectious every single time. It forms a constant baseline of protection, allowing us to stack specific, disease-focused isolation protocols directly on top of it when necessary. We apply these standard practices to every client every day. Doing so ensures we have an unbreakable shield in place well before a specific illness is formally identified. Hand washing is our primary defense. You wet your hands, apply soap, and scrub for 20 seconds, making sure to deliberately clean the backs of your hands, between your fingers, and under your nails, before drying with a disposable towel. When you're busy, it's tempting to quickly use hand sanitizer instead of finding a sink. But if your hands are visibly soiled with dirt or bodily fluids, alcohol sanitizer will simply not clean them off. Furthermore, sanitizer is entirely ineffective against severe gastrointestinal illnesses like norovirus and C. diff. As you can see here, you must use soap and water to physically wash these specific pathogens off your skin and down the drain. Once your hands are clean, you need to manage your personal protective equipment. The single highest risk for cross-contamination happens when you take your gear off. Self-contamination happens here because rushed movements flick microscopic particles onto your skin or clothing. Intentionally slow your movements down during doffing, follow the correct removal sequence, and wash your hands both before you start and immediately after you finish. Diligent hand washing and methodical doffing stop pathogens right on your skin, preventing them from spreading onto facility surfaces or to other clients. Let's consider a routine procedure where you assist a client with a self-administered injectable medication. You complete the injection, and the client is comfortable and safe. But as you finish, you might instinctively reach to put the cap on the used syringe. Recapping a needle is a critical physical error, and it remains the #1 cause of needle stick injuries in healthcare. A used needle must travel instantly and directly into a secure, puncture-resistant sharps container. You bypass the cap completely. If an accidental stick does occur, immediately hold the pricked finger under warm running water. Let the wound bleed freely to flush out any contaminants and do not squeeze the skin around it. Wash the site thoroughly with soap and water, apply a waterproof bandage, and notify your supervisor right away. They will activate the exposure plan. By placing needles directly into the bin and eliminating the recapping habit, you prevent the vast majority of exposure risks. You keep your focus on client care. Next, let's look at how we respond to sudden illness. Imagine an evening medication pass is underway when a client suddenly exhibits vomiting. Halt the medication pass instantly. Do not continue handling any supplies, and kindly ask all other clients to step away. Put on full contact PPE, specifically gloves and a gown, and carefully assist the sick client to a private room and restroom so they can be isolated. Once the client is comfortable, you must clean and disinfect all affected floors, surfaces, and restrooms. Do this in full PPE, using an EPA-registered disinfectant according to the manufacturer's instructions. Sudden vomiting and diarrhea indicate highly contagious viruses like norovirus. Because alcohol sanitizers fail against these pathogens, you must wash your hands exclusively with soap and water after completing the cleanup. By rapidly executing physical isolation and neutralizing the contaminated surfaces with targeted chemicals, you contain the localized incident and prevent outbreaks. Sometimes a client will test positive for a communicable disease during the admission process, like COVID-19, even if they state they feel fine. We establish isolation parameters immediately. The client is assigned a private room with a private bathroom, clear door signage, and a fully stocked PPE cart. For airborne and droplet precautions, anyone crossing that threshold must wear an N95 respirator, eye protection, gown, and gloves. This map tracks the medication box. It must travel with you into the room for the pass. Once the client takes their medication, the box must be carried back out. It is never left unattended. Before leaving the immediate area outside the door, You must remove all your PPE and place it directly into a designated biohazard bin. To ensure the client stays engaged during this period, we set up virtual connections so they can still attend therapy groups. Enforcing strict physical boundaries for both staff equipment and client movement ensures that isolated individuals safely receive essential care without compromising the facility. You now have the exact protocols required to execute our universal infection control practices across any scenario. Keep the baseline rule at the front of your mind. Standard precautions are never turned off. We treat every body fluid as infectious, every time, for every single client. 2 simple physical actions will protect you daily. Always wash your hands with soap and water when they are visibly soiled, and never attempt to recap a used needle. Wash your hands, drop to needle. Bring the med box out, stay vigilant during your daily routines, and immediately report any signs of communicable disease, like a lingering cough or sudden rash, straight to the infection preventionist. By mastering these daily reflexes, you protect our clients, your colleagues, and yourself. Thank you for keeping the Emend Healthcare community safe.